Well, a little earlier, I spoke with the Health Minister, Stephen Kinnock. I do want to give a warning because given the nature of the subject we were discussing and my own view that we should be talking about the details, some of what we discussed in the interview, some viewers may find upsetting. Thank you so much for being with us. Good to have you here. I'm keen, of course, to talk about your NHS announcement. But before we do, I just want to speak about the grooming gangs, the rape gangs scandal, and also separately the comments made by Elon Musk and the Prime Minister's response today. Just firstly, what is your message to Elon Musk?
Well, I think a lot has been said on this very, very serious issue. There is nothing more serious and more sickening than child sexual abuse. And I think we have to just really acknowledge and register the fact that we're dealing with a really serious and sensitive issue. And I think that the way in which the debate is conducted should reflect that. I think that what Mr. Musk has said about Keir Starmer's record and Jess Phillips' record are just plainly wrong. That nobody has done more than Keir and Jess to address these issues. Keir has done so much to lock up rapists, wife beaters, people guilty of sexual abuse, and Jess has done so much throughout her whole life and career, professional life and career, to stand up for the victims, and particularly on violence against women and girls. So I think I would gently say to Mr. Musk that he really does need to look at the information that he's putting out onto social media and let's deal with the facts. And what is absolutely clear is that Keir Starmer and Jess Phillips have the strongest possible record on these issues.
I want to talk about the substantive issue, the important issue, in a moment. But, Keir Starmer said that the lies that you describe them as lies, kind of whipped up on X, are now threatening the safety of MPs like Jess Phillips. The UK government is still on X. Should you be?
Well, look, I think we all enjoy and appreciate the cut and thrust of politics, and it is about having a robust debate. And whatever your views on social media has become a forum for political debate. And so I'm not sure
but
that
we're
just
talking specifically about the person who is now in charge of X, part of linked to the new administration coming into the United States as well. Keir Starmer says he's spreading lies. You saying he's spreading on lies. Why are you on his platform?
I think we're in politics to take people on, take the argument on, have the debate, and to demonstrate through our actions and through our words that we have the values and the plan to actually deliver for the British people. And I think many of the people in our country that are observing the sort of volley of stuff that's coming from the other side of the Atlantic are thinking, well, I'm actually far more interested in how we're going to get the NHS backlog down, how we're going to get some growth back into our economy, how we're going to fix our broken justice system, how we're going to fix our broken justice system, how we're going to rebuild the country's infrastructure. Those are the issues that people in the country really care about.
OK. Let's talk about the issue here, the important issue, the grooming gangs. And I've been thinking about this a bit because it's quite hard as a broadcaster to give the real truth about how bad some of that abuse was because the details are so graphic. Girls have been murdered. To use one example, when one 12-year-old threatened a perpetrator after she was raped, he took a baseball bat, he hit her with it around the head, and he then sexually assaulted her with it. That's just one example. But, these girls were groomed, they were raped, they were treated like meat, and the people who were supposed to be looking after them, social services, the police, the justice system, but particularly those people supposed to be looking after them, they turned a blind eye. Could this still be happening now?
Look, all the abuse that's taken place and that example and so many others, Sophie, are just utterly heartbreaking. And we have to put in place the measures that are in the Alexis J report. Alexis J did a very detailed, well-researched piece of work. It took 8 years to pull it together. It pulled together the strands from all the different local investigations that had taken place. And what we need to do is start working on implementing that. And
Well,
it's frankly shameful that that report was tabled in 2022 and nothing was done. Not a single one of its recommendations was picked up. Keir Starmer has been calling for mandatory reporting on sexual abuse for 10 years.
Let's keep the politics out of it. You know, there's been an awful lot of politics in the debate as well. So you're saying you're going to implement all the recommendations of the J report? Is that what you're saying?
Yes, that is my understanding, that we're committed to implementing those recommendations.
So when are you going to do it? Because some of them you can do right now, like a children's minister that attends cabinet. You can just do that tomorrow, right? Why don't you do it tomorrow?
We're working at pace on them, and there's a lot of work that's going on. The lead department is the Home Office. They are working and they are prioritising these issues. It is absolutely vital that we have justice, accountability, and measures in place to ensure that this kind of thing never happens again. And the government is 100% committed to delivering that.
You say that there doesn't need to be a public inquiry because there already has been one. You talk about the Alexis J report. But what some people are worried about is the Alexis J report wasn't just about grooming gangs. It was about child abuse widely. It was about Jimmy Savile. It was about abuse in the Catholic Church. It mentioned Rotherham once. It didn't mention Telford at all. There were specific issues with this scandal that impacted so many girls in lots of towns across the UK, and it was about the authorities turning a blind eye, potentially because of the ethnicity of the men who were carrying out this abuse, because they were British Pakistani predominantly. Should there not be a public inquiry into that?
Well, there were local investigations and reviews, reports, inquiries into those localised incidents.
But that's the whole point. It wasn't just a localised issue, was it? It went across the country.
Yeah, but the J report pulls those issues together. It connects the dots, and it makes national recommendations. But
it was so wide-ranging. It was talking about Jimmy Savile. I mean, I'm not saying that wasn't very important. That was very important. But it's very different, isn't it, to these girls who were vulnerable, who were let down by the authorities, who were picked off, and about, I guess, what many people would see, political correctness that stopped them being listened to.
We don't see the case for going back to square one. You could end up, distracting and having to reprioritise resources that are currently being deployed to actually deliver the recommendations of the J report. Let's get those practical, tangible measures in place. Let's ensure that those practical, tangible measures take root and work, so we start to see the systemic change, the culture change that we need to see. Of course, if we then see, as any responsible government would be vigilant, would monitor, if things are not working as they should, if there are gaps that need to be filled, then, of course, you commission more work and you get the job done.
We know those gaps are there. We know it, because the 2022 inquiry into child sexual exploitation said an accurate picture of the prevalence of child sexual exploitation could not be gleaned from either criminal justice or children's social care data. Any denial of the scale of child sexual exploitation, either at local or national level, should be challenged. It's still a problem now, isn't it?
Well, I think that the report is comprehensive. I think that, of course, when you get into the technical detail of how those measures get implemented, you'll get a much better sense then of what you may need to change, what you may need to go back to and review.
Can you guarantee that young girls in that situation now are safe? You can't, because the data isn't there.
Well, very sadly, there are people in our society who do sick and perverted things. I would love to live in a world where that didn't happen. The job of the government is to bear down on that, to do our very best to eradicate it from our society. And our view is that the practical and rapid and tangible way of taking this forward is through the J recommendations. But, of course, you always leave the door open to making any changes and improvements that might be needed further down the line.
You mentioned accountability a bit earlier in the interview and how important accountability was. Who's lost their jobs over this?
Well, that, I think, is a really important question, both for all of those who have been involved in the cases and in the investigations. I don't think it's right for me to sit here and name names or make individual accusations or allegations. But when you've got a system that is robust, accountability is a really important part of that system.
This feels to me, I understand that people feel this has been weaponised, But the reason it has been is because people feel that there hasn't been justice, that there hasn't been change, and that there hasn't been accountability. No one's lost their jobs. Social workers turned a blind eye. Police turned a blind eye. Where's the accountability? Who's gone? It's extraordinary.
With respect, I do think that that's a question for previous Conservative politicians who were in government for 14 years and did absolutely nothing about this issue.
You can do something now.
Yeah, that's right, and we are working at pace. We have said that we will implement the recommendations. You didn't even get that commitment from the previous Conservative administration. So, you know, I think we're saying, look, we're picking up on a broken system due to the neglect and incompetence of the last 14 years. We've been in power for about 6 months now. Of course, there is a lot more to do, and the government is trying to get the system up and running across so many different areas of our justice system, but also our National Health Service, you know, the economy. There's a lot going on, but this is absolutely a priority, and the Home Office is leading on it. OK, let's talk about the NHS, shall we? You've got a big announcement today. What is it? So the big announcement today is around fixing the backlog. We've got over 6 million people waiting for planned treatments, whether it's diagnostics or an operation or some other medical intervention. That is completely unsustainable. So the question is, how do you clear that backlog? And there are a range of very practical measures that we're putting forward today. For example, paying GPs to do much better referrals so that people can stay in the community when they're treated. It's about improving the app so that people can do much more around diagnostics and getting information through the app. It's about improving the appointments process so that you're getting a reminder the day before your appointment to make sure that you go, like, you know, you see that in restaurants, and that's going to improve the number of people going in and getting appointments. And another important part of it is about harnessing the independent sector. So the independent sector has capability to do another 1 million elective interventions. We want that to focus on gynecology, on orthopaedics, and on ear, nose and throat. We are absolutely not ideological about working in partnership with the independent sector so that we can ensure that we don't have a two-tier health system.
So the private sector shouldn't be a dirty word then when it comes to the NHS?
Look, we absolutely have to recognise that we've got to move quickly, and we've also got to stop this two-tier system. Right now, there are a lot of people who are, because they've got the financial means to do it, they're jumping the queue and they're using the private sector. What we want to do is level the playing field. So the NHS is doing a deal with the private sector to enable the use of the capacity that exists in the private sector, which is going to have a major impact on, particularly on those 3 areas. So we don't want the independent sector to be cherry picking. We're saying orthopaedics, gynecology, and ear, nose, and throat, where there's a lot more work that can be done more rapidly.
You say there that there's a two-tier system where people are jumping the queue. Is it morally wrong to jump the queue?
I don't think it's morally wrong, but I think it's wrong for any government to stand idly by and watch that happen. We need to level the playing field. Working people across the country should have the access at the same speed as everybody else. The principle of the NHS is that it's need that determines the treatment you get, not your ability to pay. That was a founding principle of Aneurin Bevan's NHS in the Attlee government after the Second World War, and that principle, I'm afraid, has been, if not completely broken, certainly bent a long way towards being broken over the last 14 years, and we want to level the playing field and enable people to have access to the treatment that they need.
Just finally, if you want to hit your target of 92% of elective patients getting the all clear within 18 weeks, you're going to need staff to implement this, right? What's your plan around that? I mean, are you considering relaxing visa requirements, for example?
So we want to define the model of care, define the way that our system works, and then get the staff and the resources that you need. That's the right way to do it. Don't put the cart before the horse. We're going to bring forward a workforce plan in the summer that will set out clearly how we're going to staff our community diagnostic hubs, how we're going to staff the surgical hubs, how we're going to deliver on the commitment, as you say, to get to 92% waiting 18 weeks or less for from referral to treatment. That is an extremely challenging target. We also have our manifesto pledge of 40,000 additional elective appointments per week, 2 million by July of this year. Hold us to account on that. Those are the promises that we've made to the British people, and that's what we have to deliver. We absolutely have to have a workforce that can deliver on that, but a big part of what we've said today is also about freeing up capacity, improving productivity. So even just with the workforce we have, we genuinely believe that we can actually free people up and get them working in more effective ways so that we can start to bear down on the backlog.
OK, thank you very much.
Thank you very much, Sophie.